Hello friends, welcome to this lesson. In this, we'll be discussing about some of the diseases, some small diseases which NCERT has discussed, and we'll try to know about them. Okay. So what all do you need to know? You need to know the name of the disease, okay, the causative organism, some of the symptoms, and the pathogen if there is any. The vector if there is any, and their diagnostic test and a little bit of treatment. Treatment is not that much important, but the tests and the causative organism, that is the most important thing for you people. Okay, so we'll see the very first disease. We have typhoid. The causative organism is salmonella typhi, which is a bacterium. The mode of transmission, it is by contaminated food or water. Okay, and affected organs, because it is by contaminated food or water, therefore it should be the GI, okay, gastrointestinal system. Therefore the affected system is first of all the small intestine, then by the liver, then other organs like liver and all, they are affected by the blood. So the very first organ to be affected is the small intestine. Okay, then the diagnostic test for typhoid is a vital test. You must be knowing about the Typhoid Mary. Okay, Typhoid Mary, she was a cook by profession, and she had this typhoid. She kept on spreading this for different people, in which she went to cook, and before she was diagnosed of this typhoid. Okay, so the vaccines are recommended in areas where the typhoid fever is common, but generally we don't take the typhoid vaccine. But if you are living in an area where it is common, then please do take it. Then the symptoms, if you are suspecting someone that he might be suffering from typhoid, then please see these symptoms. Okay, so sustained high fever is the very first symptom, and the high fever means 39 to 40 degrees Celsius, which NCERT mentions. Okay, and weakness, it is a common symptom of most of the diseases. Then you'll feel stomach pain because it is gastrointestinal problem. Then you'll also feel constipation. Okay, constipation is also a GI problem. Then headache will be there, loss of appetite, and in the gastrointestinal system there will be bloating, constipation, diarrhea, nausea, or vomiting. Okay, then there is influenza. Influenza is caused by Haemophilus influenzae. It attacks the lungs, nose, and throat because it is a respiratory disorder. Okay, the symptoms are fever, chills, muscle aches, cough, congestion, nasal congestion. Okay, then runny nose and headaches and fatigue, and it spreads by, it is airborne. Okay, then it also spreads by skin to skin contact and by the saliva. Then we come to pneumonia. Pneumonia is caused by Streptococcus pneumoniae. In this, there are inflamed and fluid-filled air sacs, the alveoli. They are inflamed and fluid-filled. Okay. The symptoms for pneumonia are cough with phlegm or pus. Pus. Okay, so it is a yellowish cough. Then fever, chills, and difficulty in breathing is seen in pneumonia. Okay, in severe cases, the lips and fingernails may turn gray to bluish in color. I don't know why. Okay, leave it. Just remember that the lips and fingernails, they may turn gray to bluish in color. Okay, and it spreads by airborne respiratory droplets. So pneumonia is a droplet infection, and this influenza, it is also the droplet infection. But the tuberculosis, TB, that is an airborne infection. Okay, and there is common cold. It is caused by rhinoviruses. It infects the nose and respiratory passage, but not the lungs. This is the main important thing which NCERT has mentioned. Then the symptoms are nasal congestion, discharge, sore throat, hoarseness, cough, headache, tiredness. It usually lasts for around a week. It is a droplet infection and it is a fomite infection. So what is fomite infection? Fomite infection is an infection which spreads by things, the inanimate things. Okay. Then there is something called amoebiasis or amoebic dysentery. It is caused by Entamoeba histolytica. It is a protozoan parasite of the large intestine. Okay, in this, the inflammation of intestines is accompanied by bloody diarrhea. Also, the vector for this are houseflies, drinking water, and food contaminated by the fecal matter are the main source of this infection. Okay, and there is something called plague, which is spread by or caused by Yersinia pestis, and in this lymph nodes are seen to be swollen. Okay, So basically you don't need to know anything much about these diseases. Just know the causative organism, if there is any vector, and any important means of spread, like this amoebiasis, it is spread by drinking water and food, because this is also a GI problem. See, most of the gastrointestinal problems, they are spread by the contaminated food and water. Most of them, you see amoebiasis, you can see that typhoid one also, this is also the same thing. Okay, so these are that. And the respiratory problems, they can be either spread by droplet or by air. So what is the difference between the droplet infection and the airborne infection? Droplet infection is in that you have to come in contact with the droplet while if a person infected with influenza, he sneezes in front of you and you are very close to him, and the droplets, they come in contact with you and they get into your respiratory passage, then you may get influenza. But what about TB? TB is an airborne infection. You don't need to come in contact of the droplets. It can be just spread by air, and the distance also, if you're far away also, then also it can be spread. I think it is 6 meters or something. Okay, so that's it from this chapter. Just remember the names of the causative organisms, the vector, if there is any, some of the symptoms, and any important note of spread of disease, if there is any. Okay, thank you.